Hi everybody, my name's Renee and I'm one of the dietitians here at WellSpan Bariatric Surgery. And today we're going to be talking about goal setting and exercise. So both of these things are very important, not only after your surgery, but before your surgery as well. So we are going to start with goal setting. With our goals, I'm sure all of you have goals that you'd like to accomplish, maybe in the near future or in the distant future. But we all know that it takes work to get there. It doesn't happen overnight. So today I'm going to teach you some techniques when it comes to setting goals. So go ahead and open up your notebook if you haven't already and go ahead and follow along. So you'll see this graphic in your notebook, and one of the techniques we're going to talk about is setting SMART goals. So SMART is an acronym. Each letter stands for something that we want our goals to encompass. So the S is specific, the M is measurable, A is attainable, sometimes also called achievable, R is relevant, and T is time bound. So now we're going to talk about each of those in a little bit more detail. So starting with specific. So with specific, this is going to identify the outcome of the goal and what you want to achieve. So you want to ask yourself these questions as you're setting your goal. What is it that you're going to do? How are you going to do it? When are you going to do it? And do you need more information or more help and support? So what we want to do here is avoid being too vague. So let me give you an example. A not very specific goal would be saying, I want to exercise more. That's great, but what exactly does that mean? You're not defining exercise or what more is. So a more specific goal would be saying, I want to walk 3 times a week for 30 minutes around my neighborhood after work. That is identifying what you're going to do, walk, when you're going to do it, after work, how you're going to do it around your neighborhood for 30 minutes. So try and be as specific as you possibly can. Up next, we have the M, which is measurable. So we need to have some way that we can measure our progress or our achievement. Now, depending on what your goal is, this is going to be different for each of those. So maybe it is measuring in time. So minutes, hours, it can be whatever you'd like it to be. So the example I gave previous, I said 30 minutes of walking. There we have part of the measurable component. You can also do frequency, so number of days. I also included that in the example I gave you, 3 days a week. Maybe if you're thinking more of a weight loss goal or you're measuring your food out, then you could use the amount. So I want to lose X amount of pounds in a certain matter of weeks or months. Or if you're thinking about measuring food, you could say, I'm wanting to measure out half a cup of vegetables at each of my meals. So that could be also part of the measurable component. Or you could say distance. So walking a certain amount of miles or a certain amount of steps per day. So that's the M. Up next, we have the A, which is attainable or achievable. So with our goals, we want to make sure that they challenge us, but they're also reasonable. We don't want to set the bar too high and then be disappointed if we fall short. So for instance, if you've never run before in your life, you wouldn't want to start with the goal of running a marathon. You want to build your way up. So you want to make sure that it's achievable for you. So we use something called a confidence ruler, which you can see here on the screen, and you should also have a copy of this in your notebook. So you can see this scale goes from 0 to 10. So 0 is not very confident at all, 10 is very confident. So when you're thinking through your goals, if you fall between a 0 to 3, which is not confident, then you really need to think about redoing the goals, maybe reassessing so that you can build a little bit more confidence. If you're somewhat confident, so a 4 through about a 7, that's pretty good. Maybe you just need to evaluate a little bit, change the time or the frequency so that you put yourself into that very confident range, that 8 through 10 range. We want you to feel confident. We want you to know that you can achieve this. So when you're thinking about all of this, you have to think through, well, what are my barriers? What is going to stand in my way or prevent me from getting where I need to be? So maybe that's time. All of us are busy. We have a lot going on. So maybe you need to think about how much time you have. Maybe money is a barrier, or the weather is a barrier, or injury. So think through all of the things that may prevent you from getting where you need to be, and how can you work around those? What other responsibilities do you have? So many of you have children or families that you're caring for. Of course, that's a priority, and so you have to find a way to work around that schedule and make time for these goals as well. Is there anybody who can help you? So maybe somebody is even willing to work on your goal with you and be your cheerleader or support system. Maybe they can come over and help watch your kids while you're walking around the neighborhood for your exercise. So think through all of that too. And I already mentioned the time a little bit. That's probably one of the biggest barriers that we hear often. So don't feel like you have to do your goal all at one time during the day. So the example, going back to the example I used at the beginning, I said, I want to walk 3 times a week for 30 minutes after work. Maybe it doesn't all have to be after work. If you can even find little segments throughout your day, 5 to 10 minutes, then you can work on that and build up to the 30 minutes throughout the day. So think through all that. The next letter is R, and that's relevant. So this ensures that what we're trying to achieve is worthwhile to you. You want to make sure that all the time and energy you're putting into these goals is worth it. Is this really something that you want? If you hate walking, then don't set that as your exercise goal. Is this helping you reach a bigger goal? So you have to think through, is this getting me to where I want to be in a few years or in a few months? Is this a priority for you? Because if you don't somewhat enjoy it and somewhat want to work hard for it, it's going to make it a lot less motivating, and that can be very discouraging. So really think through those things as you are setting your goal. And then our last letter is T, and that's time-bound. So with our goals, we always want to set what you could call a due date or a deadline. We need something to motivate you and something that keeps you encouraged. And that's going to be different for everybody. So you have to think through, how big is this goal? Do I need a few weeks to work on it before I think I can achieve it? Or do I need 6 months? It's just going to vary person to person and goal to goal. But you really want to make sure you do choose a date. Maybe that's June 1st or by the start of 2022. So that you have the end in sight. And then when you get to that date, did you achieve what you set out to do? If you didn't, don't be discouraged. Maybe push the end date a little further out and work a little harder at it. If you did achieve it, awesome. What are we going to work on next? Maybe we're going to increase the time or increase the amount of days. It's totally up to you, but make sure you have that end date. So just to recap, we really want to work on that SMART technique. So specific, measurable, attainable or achievable, relevant, and time-bound. At the end, I'm going to talk about a little activity we want you to work on, so we will come back to that. All right, now we're going to talk about physical activity or exercise. So we all know that we need it. We all know that it's good for us, but not everybody knows all the benefits or even what the recommendations are. So let's start with the health benefits of exercise. So of course we know the obvious ones. You exercise, it helps with weight loss, right? It can help strengthen your muscles as well. But did you know it can also help protect against chronic illness like heart disease? It can actually improve your sleep. It can boost your mood. It can sharpen your focus during the day. It can help reduce stress and can even improve joint pain and stiffness. That's a lot of reasons on why we should be exercising, and that doesn't even include everything. So clearly, it's really something that's important that we all need to have as part of our day. So what counts as exercise? Well, that's kind of up to you. I think that everybody can find something that they enjoy. It doesn't just have to be going to the gym and walking on the treadmill or lifting weights. It can be things like playing basketball. It can be raking the leaves at home, walking the dog, even dancing, like a Zumba class or dancing with your friends. The important thing is you're finding ways to get more active. So wherever you are, whatever you're doing, whatever your injuries may be, we can still find a way to adapt things and make exercise worth it for you. So what exactly are the recommendations when it comes to exercise? So in general, for Americans, the recommendations are to include both aerobic activity and muscle strengthening activity. So aerobic activity is anything that gets your heart beating faster. So you're out of breath, you can feel that you're exercising, and the goal is about 150 minutes a week. So if you were to divide that out, that would be about 5 times a week for 30 minutes. So aerobic activity could be things like swimming, walking, running, things like that. Biking even could be another aerobic activity. Muscle strengthening activity is recommended twice a week, and that would be, working specific muscle groups harder than usual. Now, for a lot of us, we probably think, oh, well, we have to go and lift weights and do machines at the gym. Not necessarily. You can do things at home too. You can use resistance bands, you can use soup cans or laundry detergent, you can do body weight exercises like push-ups or squats, and even adapt those as you need to when you first start. So talking about those goals, if you're someone who hasn't started exercise yet, that probably seems like a lot, and it is. Don't feel like you need to start with 150 minutes or with 2 days of muscle strengthening activity. Start where you need to. So maybe that means just 5 minutes a few times a week. And then the next week, maybe you increase that by 1 minute, by 5 minutes. It doesn't really matter. The important thing is that you've started that. A healthy habit takes time to build, so don't be frustrated if you're not quite at these standards yet. With time, you'll be surprised at how you get there, okay? One other thing that I want to address is the moderate versus vigorous aerobic activity. So I mentioned 150 minutes of moderate aerobic activity. So there's also vigorous aerobic activity. So the difference between the two is kind of how hard you're working. You can differentiate between the two by doing what we call the talk test. So when you're exercising, if you're breathing hard but you can still pretty easily have conversation, that would be moderate intensity activity. So if that's primarily what you're doing, the goal is 150 minutes of that a week. When you're exercising, if you're doing the talk test and you can only say a few words before having to stop and really breathe and catch your breath, that would be more like vigorous intensity. So if that's the case, you can do less minutes overall, so about 75 a week. And examples of vigorous activity would be like running or swimming, things where you're really, really out of breath, okay? So those are the exercise guidelines. I would just encourage you, like I said, to start somewhere. Don't be frustrated if it's only a few minutes at a time. The important thing is you've started that healthy habit and you're going to build from there. So in your notebook, you'll find there's a few questions about the information we went through today. So take a few minutes and answer those to make sure you're really understanding everything. There's also a page in your notebook with more information and guidance on how to set SMART goals. So take the time, try and think of at least 2, but there is space for 3 goals that you want to work on. So take all the time you need to work on that. Really think through each of those letters in SMART and what you want to accomplish in the long run. Along with that, there's also a goal tracking sheet, so you can hang that up on your refrigerator and you can mark off how many days a week you were able to accomplish your goals. So that's all for today. I hope you were able to learn something about goal setting and exercise. As always, if you have more questions about anything, please feel free to reach out to us through the portal or give our office a call. We're happy to talk to you anytime. Thank you.